16 meters ago, people who recently got vaccine should look for symptoms. CDC says anyone who received the Johnson & Johnson vaccine within the last couple of weeks should be aware to look for any symptoms, said Anne Schuchat, Principal Deputy Director of the CDC. Those who develop severe headache, abdominal pain, leg pain or shortness of breath after getting the vaccine should contact their healthcare provider and seek medical treatment, she said. Schuchat said the risk is very low for people who received the Johnson & Johnson vaccine more than a month ago. 34 meters agoFDA official explains issue with blood clots. Peter Marks, director of the FDA's Center for Biologics Evaluation and Research, said in a briefing Tuesday that the issue with the kind of blood clots being investigated is with treatment. That if one administers the standard treatments that we as doctors have learned to give for blood clots, one can actually cause tremendous harm, or the outcome can be fatal. So one needs to make sure that providers are aware that if they see people who have low blood platelets or, if they see people who have blood clots, they need to inquire about a history of recent vaccination, and then act accordingly in the diagnosis and management of those individuals, he said. This was taken rapidly in order to honor our commitment to the American public to ensure that any safety signal that came up during this vaccine rollout was addressed in a transparent manner. 10:10 a.m. White House. Recommended pause will not significantly impact vaccine plan. The White House says the recommended pause will not significantly impact its COVID-19 vaccine plan given that the Johnson & Johnson vaccine accounts for less than 5% of the total number of shots administered in the U.S. as of Tuesday. Based on actions taken by the president earlier this year, the United States has secured enough Pfizer and Moderna doses for 300 million Americans, Jeff Zients, the White House COVID-19 response coordinator, said in a statement. Over the last few weeks, we have made available more than 25 million doses of Pfizer and Moderna each week, and in fact this week we will make available 28 million doses of these vaccines, he said. This is more than enough supply to continue the current pace of vaccinations of 3 million shots per day, and meet the president's goal of 200 million shots by his 100th day in office and continue on to reach every adult who wants to be vaccinated. Zients said officials are working with state and federal partners to get anyone who was scheduled for the single-shot vaccine to get Pfizer's or Moderna's vaccine instead. Updated 9:41 a.m. New York. Mississippi moved to implement pauseStates. Swiftly moved Tuesday morning to implement the pause. New York State Health Commissioner Dr. Howard Zucker said the state will follow the recommendation and pause the use of the Johnson & Johnson vaccine at state-run sites.